Hello everyone, my name is White Beaver and I will be informing all of you about how smoking affects an athlete. I'm an athlete myself and I take pride in the fact that I have never smoked and I have maintained a healthy body, allowing me to perform at the top of my game. For an athlete to perform at the top of their game, this individual needs to be mentally and physically ready for each game, each training session, and each practice. On a physical level, cigarettes set back an athlete a significant amount. When an athlete is also a smoker, they cannot perform at their prime because they are set back by shortness of breath, constant and painful coughing, dizziness, and lack of oxygen, which makes it harder to breathe. As you know, there are many chemicals inside a cigarette that are very harmful to a smoker. The first chemical that we'll discuss is tar. Tar causes staining of the teeth, the fingernails, and also inside the lungs itself. Tar has also been suspected of causing certain kinds of cancer, which we will discuss later in the video. Carbon monoxide is another incredibly dangerous chemical that is inside the cigarette. Carbon monoxide is silent but deadly, and because it has no odor, and if exposed to large doses, it can cause death. For hydrogen cyanide, it destroys the tiny hairs, the cilia, inside the lungs. The cilia are very important because they transport unknown and foreign substances away from the lungs and outside of the body. Without the cilia, poisonous chemicals build up in the lungs and can be very detrimental to this individual's health. Metals, yes, metals are put into cigarettes, and the three major metals in the cigarette are arsenic, cadmium, and lead, which are all carcinogenic, meaning that they cause cancer. And another thing that causes cancer in cigarettes is radioactive material, which is found. Effects that are felt by the lungs are both the trachea and the larynx are irritated by each puff of a smoke. Because the smoke irritates the throat, the lungs' airways swell and narrow. With narrow airways, less oxygen can reach the lungs and can't further disperse around the body. The lungs' clearance system is also compromised, which allows the buildup of many harmful substances, therefore causing damage and irritation. Like I explained just a minute ago, the clearance system finds and expels of foreign and potentially dangerous substances. And finally, permanent damage applies to air sacs in the lungs, which help produce oxygen. The circulatory system is also affected by smoking greatly. Blood pressure increases as well as the heart rate. But as an athlete, you're kind of used to blood pressure and your heart rate increasing during each sport. But when an athlete is at rest and not doing that sport, blood pressure and heart rate can be an issue for the heart itself. The blood vessels are also constricted when you smoke, which causes the blood temperature to drop. Not only does the temperature drop, but less blood is carried to the extremities, which I'll touch up on later. There's a loss of oxygen that's being carried by the hemoglobin during physical activity, which is also a symptom. So when you inhale a cigarette, carbon monoxide overpowers the oxygen, and for the red blood cells, they don't transport oxygen, and it's not carried by the hemoglobin. This is especially important for athletes to know. Without high amounts of oxygen being spread through the body, it is easier to fatigue, have shortness of breath, and performance can decrease greatly. Smoking also causes thicker blood, which can be a major factor for clotting. Linings of the arteries are also damaged when you smoke, which have been linked as a contributor for arteriosclerosis, which is just a buildup of fat deposits on the walls of the arteries. Blood flow to the extremities is also reduced. Not enough oxygen gets to the fingers and toes and can cause a lack of performance significantly. With the heart working extra hard to push blood to the extremities and the brain, it's put under a lot of stress, And also because smoking causes the blood to thicken, this can cause heart attacks, brain aneurysms, and strokes. Other effects caused by smoking include scent and your taste weakening, early wrinkling of the skin, and this should concern all smokers because who wants to look old at such a young age? Gum disease is also a symptom, and these next three symptom examples I'm about to list are three examples that pose great threats for athletes. Inflammation and irritation of the stomach and intestines, development of ulcers along the digestive tract, which can be very painful and may require surgery to fix, and a higher risk of blindness, which is very concerning for anybody, not just athletes. Now, if you could please go and check the video I have posted in my PowerPoints. It is a quick 1.5-minute long video sharing how significant 60 smokes can be to a human being. In the video, you can see massive differences in just 60 cigarettes. Without looking back at your notes, can you explain to me why the trachea in the video has changed colors and looks to have collected substances? If you guessed because of the tar and hydrogen cyanide, you are correct. The tar is the reason why you can see the discoloring, and the hydrogen cyanide destroys the cilia, which then allows a buildup of potentially harmful substances. Now, everybody knows that cancer is a effect or symptom of smoking, but smoking isn't the only reason why people get cancer. The lung, esophagus, larynx, mouth, throat, kidneys, bladder, pancreas, stomachs, cervix, and breast cancer are all affected when you smoke, and it increases the amount of chances of contracting cancer. Smoking doesn't really limit itself to where it influences cancer to grow, and the way smoking causes cancer is not directly caused by the materials in the cigarette itself, but because the chemicals inside the smoke alter a person's DNA, making genes that help protect against cancer irrelevant because the gene is changed completely. But it's never too late to quit. Whether you've been smoking since a young age or you just started and want to quit, it is never a negative change in your life. And it has shown many benefits. As displayed by the benefits of stopping smoking, it has been proven that if you stop smoking before the age of 50, you decrease the risk of dying from smoking-related diseases by 50%. It was also proven that in the same study that all symptoms of smoking can be reduced significantly after quitting. Right after quitting. I also found a chart that lists all the benefits that happen directly after quitting. So after 6 hours, your heart rate slows. After 12 hours, your body is completely free of nicotine. After 2 days, your sense of taste and smell improves, and your breath, clothes, and house will smell fresher. After 1 month, your blood pressure improves, and your immune system begins to recover. After 2 months, your circulation and your circulatory system improves. You will also have more energy, and your fingers and toes will stay warmer. Again, after 2 months, your risk of heart attack begins to reduce. After a complete year, your blood pressure returns to normal. After 10 years, you have halved your risk of developing lung cancer compared to someone who continues to smoke. After 15 years, the chance of suffering a heart attack or stroke is the same as a non-smoker. I hope that all the information I've shared with all of you has inspired the smokers to rethink your actions or at least understand what you're doing to yourselves. This doesn't make any of you bad people in any aspect. But I also hope that I have made all of you non-smokers feel awesome about yourselves because you are doing a really awesome job. So keep it up. Thanks for watching.